Hi, I'm Dr. Joe Suker with the Arizona Trauma Association, and this is Trauma in a Flash. Over 300,000 hip fractures occur each year in the United States, and most are due to ground-level falls in people greater than 60 years of age. In fact, ground-level falls account for over 44% of Arizona trauma center-related admissions, making it the leading cause of trauma in the state. Furthermore, people over the age of 60 experience the highest rate of trauma in the state of Arizona. The term G60 trauma is used to describe the group of trauma patients over the age of 60. G60 trauma patients commonly have multiple comorbidities and have an increased incidence of complications as compared to their younger counterparts. In 2016, the Arizona Trauma Association members published a retrospective Level 1 Trauma Center multi-institutional study. This included 3,251 ground-level fall patients followed over a 3-year period. This group had a median injury severity score of 9 and an overall 3-year mortality of 31%. Those patients with head and spine injury were at highest risk to die in the first 30 days and had a median ISS of 16. Deaths that occurred after 30 days were linked to the patient's prior health status rather than due to the traumatic injury. We contend that early, aggressive surgical management and medical care are cornerstones to reducing 30-day morbidity and mortality. One clearly important part of the patient's medical management is optimal pain control. For over a century, narcotics have been the primary tool for pain management. But in the G60 trauma population, narcotics can lead to serious complications such as delirium, hypotension, ileus, and even respiratory failure. Therefore, pain management protocols that utilize multimodal therapies have been instituted to reduce the need for narcotics. This includes the scheduled use of agents such as acetaminophen, COX-2 inhibitors, and gabapentin. Additionally, peripheral nerve blocks are an excellent adjunct to multimodal pain management. The fascia iliaca block with placement of an on-cue catheter for continuous nerve block is an excellent therapy that is optimally initiated when the patient is still in the emergency department. This can be continued through the postoperative period. The fascia iliaca block with ultrasound guidance is safe, effective, and takes only minutes to perform. In a 2015 pilot study published in the Journal of Trauma and Acute Care Surgery, Manger et al. Found the fascia iliaca block to be safe and effective. In our experience, we have seen immediate and continued pain relief in our hip fractured patients. In the next video, we'll cover the technique of fascia iliaca block with the on-cue system. Thank you for watching this week's episode of Trauma in a Flash.